Hey y'all, welcome back to my YouTube channel. For those of you who don't know me, allow me to introduce myself. My name is Evelyn Parra and I'm a student attending the University of California, Irvine. Are you ready for some knowledge you can't get in college? Anyways, today I am here to discuss the topic of, may I have a drum roll? Medicare! Alrighty, before we begin, I do recognize that there are sometimes the common mix-up between Medicare and Medicaid, so allow me to explain the differences between the two. Medicare is generally for people who are 65 years or older, or for those who have a qualifying disability. We'll go into depth about that later. Medicaid, it's also known as Medi-Cal in California. I think we understand the correlation here. Anyways, Medi-Cal is for individuals, families, and children with limited income and resources. Unfortunately, I will not be going into depth about Medi-Cal or mention it again, so count your losses. The focus for today is Medicare, so here we go. So when it comes to Medicare, there are 4 subdivisions within Medicare itself: Part A, Part B, Part C, and Part D. So each of them are unique in their own way, but they can work together in order to provide a specific health plan. Of the 4 subdivisions, I will be talking about Part A first. So up here, I have a screenshot with me that is actually from Medicare.gov, as shown up above at the top of the screenshot that I'm showing up here. So I had taken this from the website itself, where parts A, B, and C, and D come from. Even though it doesn't mention D, there are other resources to find about what Plan D is about. So moving along, as you can see, Plan A is hospital insurance. Well, what does that mean? Well, when it comes to Plan A, it from the website themselves, actually, it's inpatient care in hospital stays, skilled nursing facility, hospice care, and then other types of health care. So, for example, let's just say I hurt my leg. I'm 68 years old. I hurt my leg doing something. I can actually get that care provided for me. And an actual real life example I have for Medicare, Part A specifically, is a story of my grandfather from last year. So he unfortunately fell down a ladder, and he was actually able to cover it. His hospital stay, I believe it was like a couple weeks or so, due to his injuries, and it was all covered under Medicare. He himself had Plan A and Plan B. So you may be wondering, what is Plan B? Right up here, as you can see after Plan A is listed. So Plan B is a medical insurance, and what that means, this is also from the website themselves, it covers certain doctor services, outpatient care, medical supplies, and preventative supplies. So when it does come to preventative services, what it means that Medicare provides is that it'll provide exams for checking if there's any diseases present, any shots that are required to take that someone should be taking for their health. For example, like a tetanus shot. And then lab tests, and then screenings, for example, a mammogram. Women from around 50 to 55, around that age range to 74 years old, should be getting tested every 2 years. So Part B would be able to cover that. Before moving on to Part C of Medicare, normally when someone retires or they reach the age of 65, it does automatically transfer for them to be able to be enrolled into Medicare. Why someone would apply, that's going to be talked about later and discussed later, because that's a different topic of why would someone apply. For example, if someone has a disability, they would need to apply for Medicare in order to get some type of coverage. So for those who have Part A and B Medicare, it was recommended, especially coming from my grandparents used to, from themselves, to have another insurance on top of that, because Medicare will not cover everything. So it is more of a recommendation. One can choose. So an example is literally my grandma. She does have another insurance above that. And the way that it's paid for with insurance for Medicare is that they actually take out of your Social Security automatically. So you're not like, oh my gosh, how do I pay for it? Like, so you're not worried about, oh my gosh, I need to pay this, I need to pay that. You already have that deducted from your check. So now we will be moving on to Part C, right up here. This is Medicare Advantage plans. This is actually from Medicare.gov. Once again, so what that means is a Medicare approved health plan from a private company. I'll give an example of that right after. So it's something of your choice that you can choose to cover your Part A and B benefits, and normally if it is a private plan, it will normally cover Part D. Part D is drug coverage, so a lot of people with basic Medicare don't have Part D available, just A and B. So Part C, an example of that was my late grandmother, rip her, actually had her own insurance. She had Kaiser provided by her job for the rest of her life, just because she did get injured. So instead of being under the basic Medicare plan, like I said, she was covered by Kaiser. So that was very nice for her. So like I talked about earlier, as you can see right up here, the original Medicare includes A and B. And so you would have to add Part D, drug coverage, in order to get those benefits. And as I was saying with my grandmother, how she was told to, how she was recommended to add another health insurance on top of that, her own health insurance as well. It does recommend it here. You can also add a Medicare supplement insurance, a Medigap policy to help pay for your out-of-pocket costs. It just depends on really where you go and what's recommended for you. I will not be listing what my grandma has, but she is provided by her own insurance, and like I said, it was recommended for her in case there were any costs that were not able to be covered, and that as well is also automatically deducted from her Social Security. So it's very important to realize that a lot of these Medicare can be deducted from your Social Security automatically, and it does automatically work for you once you do retire. So, looking at images, am I eligible for Medicare? I feel like this is a useful image to see for those who are looking for some type of health insurance assistance, especially if they're getting close to that age or maybe have a disability. You can actually look at this little image, and I feel like it's pretty useful with the basic information that it has. So I will be going into depth about for those who are disabled or for those who have maybe terminal illness and what they can do in order to have Medicare or have those type of benefits. So for those with disability, normally if you were receiving Social Security disability insurance, you would automatically 24 months right after. So on the 25th month, you would be automatically enrolled into Medicare plans A and B. If you do, if there's sometimes people have disabilities and they need to apply for SSDI, this is the number to call up here. I really do like how it has deaf or hard of hearing, because not everybody is able to talk on the phone, and so it's more like an inclusion type of thing that I really like. So right up here it does show that you could be automatically enrolled, as you can see in the text up above. And so if you have a disease, or if you have end-stage renal disease, ESRD, or ALS, you can actually get your plan much sooner. For ESRD, it's actually, you can get Medicare the 3 months after your first treatment, and then so basically you can get it sooner than 25 months. So open enrollment is October 15th, December 7th, so it's ending very soon. So what that means, if you want to add more to your plan, you can actually discuss with someone about adding more to your plan or just changing it up a little, just so you have that information provided. Thank you.